Have you been recently diagnosed with atrial fibrillation and left with more questions than answers following your diagnosis? If so, then stay tuned for this short video that will help you along this process. After a visit at the doctor's office, Susan was diagnosed with atrial fibrillation. The doctor showed Susan she had this using what's called an electrocardiogram. In the electrocardiogram, the doctor shows Susan that her electrical activity in the heart is behaving in an erratic fashion. She highlights the fact that the tracing that Susan has contains no P wave, no atrial contraction, and an irregular ventricular rhythm. Susan at the time was grateful for the diagnosis, but upon returning home, she was frustrated and confused and left wanting to understand more about what was going on inside her body. She took it upon herself to go on the internet and help her with her diagnosis and understanding it. To understand this, she went back to review her heart anatomy and physiology. She Googled, "How does the heart function normally?" The heart has 4 chambers, 2 atria and 2 ventricles that are separated on the left and right sides of the body. Blood flows from the right atrium to the right ventricle and then to the lungs. From there, oxygenated blood flows back into the left atrium and then to the left ventricle. Following this, the left ventricle will pump blood through the arch of the aorta and to the rest of the body. Within the upper right chamber of the heart, there's a group of cells referred to as the sinoatrial node, and this is the heart's natural pacemaker. The sinoatrial node, or SA node for short, produces the electrical impulse that produces each heartbeat. Contraction of the heart begins with the SA node initiating the electrical signal and traveling through the atrioventricular node, followed by the bundle of His into the Purkinje fibers and the bundle branches. This will allow the heart to contract in rhythm. This understanding provided Susan with a base to understand how her heart functioned normally, but she was still confused about what happens during atrial fibrillation. She researched what is atrial fibrillation and how does it differ from the normal heartbeat. Her search led her to discover that atrial fibrillation is a condition that causes an irregular beating of the heart atria. In this fibrillation, the atria contract abnormally and chaotically with extremely rapid rhythms, sometimes beating faster than 150 beats per minute when the usual is 60 to 100 beats per minute. Electrical problems with atrial fibrillation can include the fact that the SA node does not start the contraction properly, that the electrical current doesn't flow in an organized fashion, or that the electrical impulse originates from random spots in the atria that are not in the SA node due to changes to the tissue. This electrical disorganization creates a lack of atrial contraction, which makes the beating heart look like a bag of worms. The chaotic electrical signaling in the atria can also result in the ventricles beating out of rhythm, which can further dysregulate the heartbeat. Overall, this makes the problem even worse. With all this research, Susan began to wonder what exactly put her at risk for atrial fibrillation, as she thought she was a healthy individual. Upon thinking hard about her history, however, she found a number of possible risk factors of atrial fibrillation and began to check all the boxes that applied to her, which included hypertension, which was previously diagnosed, old age, as well as a family history. Atrial fibrillation can present itself in a number of symptoms, which include, but are not limited to, palpitations or those racing and uncomfortable sensations you get in your chest, weakness all over your body, the reduced ability to exercise, fatigue, lightheadedness, dizziness, confusion, shortness of breath, and overall chest pain. With such a long list, it can be really frustrating to deal with such symptoms and can often leave Susan unable to do many of the tasks that she was previously able to do in her life. She was a bit frustrated with herself that she didn't recognize these signs earlier and talk to her doctor. So it's very important that upon any suspicion that there's something going wrong with your heart, you make a visit to your doctor as soon as you can. Now that Susan better understood her diagnosis, she was curious how this arrhythmia could impact her future and started looking at some of the risks that she had. One of them was stroke. And stroke can occur because of the fact that the heart is beating chaotically, and that because of this, blood can start to pool in parts of it. This can result in blood clots forming in the atria, which can then dislodge and travel to the ventricle. From here, the clot can get pumped out to the rest of the body, where it can travel towards the brain. If a blood clot reaches the brain and blocks blood flow, it can cause a stroke, which can have detrimental effects to Susan's neurological functioning. Susan also found out that atrial fibrillation can lead to heart failure. This is due to the fact that this condition can weaken the heart to the point which it cannot pump enough blood to meet the demands of the body. Ultimately, Susan found that both of these complications can lead to death, which she found quite concerning. This prompted her to continue her research to determine what the possible treatment methods are for atrial fibrillation that could reduce her risk for these complications. Susan found that there are both non-surgical and surgical approaches. She began by exploring some of the non-surgical options. Electrical cardioversion is a procedure in which a low-level shock is applied to the patient using paddles in an attempt to reset the heart to its normal rhythm. Another option are drug therapies, which try to aid in dealing with this. A common one is the beta blocker, and the beta blocker attempts to reduce her heart rate, as the heart is beating very, very fast, and so beta blockers are going to try to reduce this. Some more invasive examples involve surgery. Pacemakers are small electrical devices that regulate the heartbeat, and they may be surgically inserted into the chest to treat atrial fibrillation. Another and new, more experimental therapy is cardiac ablation, where surgeons actually zap the part of the heart that is causing this irregular rhythm to make sure that it can't take over and cause this arrhythmia. Having heard about her mother's recent diagnosis of atrial fibrillation, Susan's daughter Karen approached her with fear about her own heart health. Since Susan has done so much research about her new diagnosis, she is able to share some of the prevention tips that she has learned. These include eating a heart-healthy diet, increasing physical activity, avoiding smoking, maintaining a healthy weight, limiting or avoiding caffeine and alcohol, as well as reducing stress. Overall, Susan found a great deal out about her condition and hopes that this video is going to be able to educate other elderly individuals and encourage them to seek help when they need it if they ever have concerns with their heart. That's all for today, folks. Thank you for listening, and please take care.